Welcome to the Speaking of Women's Health podcast. I'm your host, Dr. Holly Thacker. I'm not exactly in the Sunflower House today. I'm in my office in the Center for Specialized Women's Health. And I'm so happy to be joined today by a special guest, a recurrent guest that you might remember from season 2. I'm speaking with Dr. Rachel Rosen. Dr. Rachel, as her young patients fondly call her, is a board-certified pediatric dentist, and she is the owner of Great Beginnings Pediatric Dentistry in Twinsburg, Ohio. And she's the only Breathe Institute affiliate in the state of Ohio, which is a pretty big state. And as I mentioned, Dr. Rachel joined me back in season 2. And I'm so thrilled to welcome her back in season 4 to talk about all the latest in pediatric airway health, an area that's rapidly evolving and impacting how we care for children's health. And as you might remember, I met Dr. Rachel Rosen when I was so upset that my first grandchild, and now I'm expecting my 6th, when she was 2 and she jumped off a couch because she thought she was a superhero and smashed in her teeth. And I'm happy to report that she's now starting to lose teeth and get her adult teeth, and her smile is beautiful. And I really so appreciate Dr. Rachel's excellent care. And I was so enamored when I went into her practice. It was so child-focused, and I had 3 of my own kids and took them to the dentist to get all their dental care and never experienced anything like that. And even though most of our listeners, and we're in 100 countries, and we were in the top 25% of podcasts on Buzzsprout, probably are past the pediatric stage themselves, hopefully they have some little ones in their lives. So welcome, Dr. Rachel. Thanks for coming back.
Thank you for having me. I'm super excited to be back and to talk about, I know it's been a few seasons, but a lot has changed and evolved, so it's exciting to be here.
And I understand that you returned from a conference at the Breathe Institute. For those of us unfamiliar, tell us what the Breathe Institute is and why it's become such a hub for innovation in airway health.
Yeah. So the Breathe Institute, it's an institution. It's out in Los Angeles. It was founded in part by Dr. Sagi, who's a sleep ENT. And it's a pioneer globally for everything airway breathing. And they're looking at infancy through adulthood. So I'm really, as the affiliate there, learning how to care for the entire person, which I think has been huge. But they're putting out research, and we haven't had medical-based research on a lot of this stuff. And that's one of the biggest goals, is to actually get this in the hands of providers who want research. And they're doing that every single day, which is amazing. Yeah.
And so what are some of the highlights, or how has it changed your practice? What things have you brought back?
So when I just came back, like you mentioned, from out in Los Angeles, I was actually there doing part of my affiliate training. And part of the affiliate training is that I'm actually able to go to the clinic one-on-one and see everything from how they operate to how Dr. Zagi is doing procedures to the day in and day out. I actually was watching them publish research while I was sitting in there. So instead of sitting in a group of people like you do at a course, I'm getting hands-on one-on-one training, which was amazing. And I'm able to kind of cherry pick and bring things back home and apply it into the practice, and hopefully one day a larger airway center where we have that in Cleveland, because there's such a need for it. So it was fascinating, eye-opening, and really had the opportunity to learn one-on-one from the expert in this field, which was amazing. I have no words, because I came back having 1,000 things in my head that I want to do to bring that type of care here. I'm practicing that way in the practice, at doing the releases I do and the comprehensive care, but having the providers under one roof and the ability to have those collaborative conversations was so nice. And it's what we need.
I see so many overlaps with what I did when I opened up this center, which I'm physically in, for Specialized Women's Health. I realized to take care of a patient, you need perspectives from different specialties, and we're all kind of so siloed by gender or age or organ system. And
Mm-hmm.
really, each person is totally connected and is one person and may need a lot of different perspectives.
And
Is
it's
there,
yeah.
is this, so this Airway Institute, is it both for children and adults or
Everyone. And I
everyone?
think that, like, even though I'm running a pediatric office, right, and I'm seeing children day in and day out for their routine dental hygiene and things like that, but on the airway side of it, it's everyone, right? And we're looking at parents who are saying, this was me as a child and no one corrected it. And we actually have the opportunity to do those things. At the Breathe Institute, they're seeing kids through adults. There's sleep medicine, there's ENTs, there's orthodontics, myofunctional therapists, pediatric dentists. So like it's a very collaborative approach, which I don't think we have here. And just like you're saying in medicine, we tend to treat things very in isolation, but the airway is such a huge piece of it and connecting to our entire body. So I'm working with different providers. I'm working with orthodontists and speech language pathologists and occupational therapists and myofunctional therapists. When I'm doing the work I'm doing, it's just not in my office.
Oh, okay, okay.
Yeah.
And you made the comment that you do a lot of releases. Is that when you clip the bottom
Mm-hmm.
part of the tongue? Is that for breastfeeding or breathing or
All of it.
dental development?
Right. So ultimately where I play the biggest part is I'm almost the quarterback of these kids' lives, right? They're
Hmm.
coming into me, potentially like having worked with other providers or having not worked with other providers, and their symptoms and figuring out where these symptoms are coming from. We are all tongue tied and lip tied. We're all connected. It's part of our fascial system. So when I'm looking at things, I'm looking at function and how is this functionally affecting things and where are the symptoms? Because you could look really poor to the eye on a grading scale, but be functionally quite fine. And you may look not the worst on a grading scale or not function the worst on a grading scale, and have all these symptoms. So then
Uh-huh.
it's figuring out who is the team that needs to be involved in this. And then ultimately, yes, I do what's called, in a baby, it's just a release, right? It's very minimal to the fascia. But as we get into an older kid, into an adult, it's functional frenuloplasty, where we are going in and we're addressing this in a very, with a holistic functional approach to get the most out of that. But that comes from having the right space and the right oral motor function. So
And
there's a
so
lot of players, right?
and so what are some of the symptoms that parents or the children come in with to present with to
So
make
when
you
I'm
think they
seeing
need
like
this?
infants, right? Like that's the mom who's having breastfeeding symptoms or bottle feeding
Yes.
symptoms, right? And that's where there's a dyad. So I'm not treating the mother per se. I do have red light in my office, which I will offer to a mom if need be, if she's really uncomfortable. But I'm looking at the baby symptoms.
Now,
So
wait,
are they
tell me about the red light to the mother. Is that red light to the breast?
yes. So
'Cause I did a podcast earlier on red light, and it's like it seems like it's all the rage for so many things.
yes, I have a Sumis medical grade red light in my office, which is phenomenal. And I'm able to help improve healing outcomes when I use it. In a mom who's uncomfortable, we're doing just red light on their breasts and wherever area, the areola or the breast tissue, whatever's most uncomfortable. And it's pretty instantaneous where they can actually then, I've had parents who are like, I can't even put a shirt on. Like the mom's like, I have protection between this, and we do the red light therapy and it's gone. So being able
Wow.
to offer that for the infants that I release is huge because I want them to be able to feed after. And then and be able to continue that relationship if that's what they're trying to go for. I do have parents who come in that are strictly bottle feeding, and I help them figure out that. Again, with the lactation specialist, with the body work specialist, like it's a whole team of us. But when I do releases, I'm also using the red light on those babies. Preoperatively to help with the release, decreasing the pain, and then
Huh.
also postoperatively as we need in terms of trying to improve the healing outcomes and the inflammation, which is it's been one of the newest things I brought in that has been, I can use it dentally across the board with kids with trauma. Like you mentioned with your granddaughter, like had I had that, I tend to do it, if a kid's in a lot of pain. But when it comes to my releases, that's why I initially bought it on. But I'm finding a lot of other dental ways I can use it in the practice, which has been really nice.
Interesting. And do you use local anesthetics as well?
Yeah, so when I'm releasing a baby, absolutely, I use topical. When I release older kids, it's topical and injection. Same thing with an adult, but it's the infants. What we're looking at is, are they coming in? Are they having reflux? Are they Or is the mom uncomfortable? Are they having spitting when, frequent spit up? Are they dripping out of a bottle? Is the lip pinching? Is there curling? Can the tongue not like, is the tongue movement not there? Is the function not there? And a really young infant, I can test this function. Once you're a little bit older, we have different ways to look at that. So that gets into, then how does transition to solids go? Can you transition to your solids well?
Mm-hmm.
Are you pocketing, spitting things out, choking, gagging? How are gross motor skills? You talk about the whole body. The fascial system affects the ability to transition to crawling and then to walking. And, the AAP just got rid of crawling as a milestone, but from a functional perspective, and I'm looking at that's such an important piece of how we integrate everything. And oral motor is so tied to that. So we're looking at, are you reaching those milestones? And then we're looking at how's
So
speech
are
developing.
pickier
Yeah.
eaters usually slower to reach their milestones motor
I think
wise?
there's definitely a correlation, right? Because you're looking at the
Uh-huh.
fascia system. If you're tight, if your fascia is tight, your gross motor skills are going to be tight. We're going to see that, that there's, and I'm not an OT, but I work with a lot of occupational therapists, right, and physical therapists who are looking at that, and they're seeing the tension in the body and how that's affecting everything else. There's actually a lot of new push for looking at all the planes, the eye plane, the occlusal plane, the pelvic plane, the plantar plane.
Mm.
And I, there's a group, I'm actually in the middle of another masterminds program. And one of the conversations we had was with podiatrists, with ophthalmologists, with pelvic floor PTs, and looking at all those things, which is fascinating because we talk about how this affects us for our lifetime. And there's actually adults that have had releases, and I've done them, where they're having pelvic floor issues. And then you do a release, and it's, it releases the tension. Not to say
That's
that,
so
the
interesting.
release is icing on the cake, right? They're doing all this other therapy and all this other work, but it's like, let's get rid of that fascial tension.
That is so fascinating. I have done other podcasts with minimally invasive surgeons, gynecologists that specialize. Dr. Goebbels was on, where we talked about chronic pelvic pain and the role of physical therapy, and they deal so much with fascial release post surgery. I know I dealt with it. My husband had major spine surgery, and you know, you don't get that in traditional medicine, like, and it's not taught. And then we went and saw the physical therapist, who also I'll have on the podcast, who said, yeah, we're in business because of surgery and the need for fascial release.
Yes,
You
yes.
know, and I do think it's hard for patients. I saw a lady the other day in the office who came to see me for my concierge program, um, which, they pay some money up front, and then they get more time and the nurse involvement. And she said, like, I had to come here to have someone listen to me instead of just go to 10 different subspecialists, and everybody has their tiny little piece, and then you have this person who's kind of like left out in the cold. And then if you are not medical yourself or don't even know the lingo,
Yeah,
it's
yeah.
overwhelming. And then I guess if you add a child to it who may not even have speech yet to even communicate what their issues are, I can see why the more integrative, the better it is.
Absolutely. And that's one of the biggest things. Like, I have parents come to me and they're like, I have seen so many other providers. I've been through so many systems and no one's listening to me, and I know something's wrong. And until you know what to look for, you don't see it. And it's not necessarily that individual provider's fault. They just don't know any different. But now that I see it, I can't unsee it. And I've formulated an amazing network of providers in, even outside the greater Cleveland area. I have patients that come from all over. And we're just getting those teams together and providing them comprehensive care. And I think that's what's so important.
That's
Yeah.
fabulous. And I think it's good advice for parents or anyone who's taking care of someone who they have to be in charge of their medical care and overall care, that at a gut level, if you think that there's something wrong
Hmm.
and you've been told it's not. I went through that with my middle son in elementary school. He wasn't progressing in reading, and he still was a smart student and doing very well. And teachers, he had no behavior issues. They were fine. I knew there was something wrong. And they even brought the psychologist in to talk to me to say, each child's different, and you have a very bright older son, so you can't expect him to be like the second son. I'm like, no, I'm not. I think there's something wrong. I think he needs extra testing. They were really irritated with me. I finally found an optometrist who did testing of eye tracking, and he had very weak eye muscles. and he had to do three-dimensional care. Luckily, we had computers and, he could do it at home. But in the old days, I guess they had to keep bringing the child in like every day to the
Mm-hmm.
office, which would have been very hard for me running my medical practice.
Yeah.
Anyway, suffice it to say, he did this three-dimensional um, therapy, and he jumped up like 3 reading grades. And he said he didn't have headaches anymore. And I said, I didn't know you had headaches. He's like, well, I told you I did, which he didn't really tell me that way. But again, he's a child.
Mm-hmm.
And then once the muscles were tracked, it was great. But even to this day, and he's, postgraduate level, very successful, has got his family, very smart guy, ranked at upper level chess levels. Um, he still prefers to listen to audiobooks as opposed to read.
Terry.
And I really think that just the delay of a year or two from first to second grade and me figuring that out,
Yeah.
affected it. So I'm sure you have so many stories. And you are listening to the Speaking of Women's Health podcast. I am your host, Dr. Holly Thacker, a women's health specialist, but care about all ages, all people, all problems. And we're talking to pediatric dentist, Dr. Rachel Rosen, who is an expert in the airway and the main one in this area. She's quite a trailblazer, dealing with being very multidisciplinary and functional in looking at the airway.
Yeah. I appreciate that. Thank you, Dr. Thacker. Yeah, it's just, and going back to what you were saying a minute ago, like, I always tell, we can fix any of these at any age. It just gets harder the older we get. So I had, one time I heard someone explain it. We talk about hours old, days old, weeks old, months old, now years. And our body is slowing down. So when I have the opportunity to see babies within the first days of life, that's my, almost somewhat of the easiest because they haven't formed all the bad habits and we get a great team together. Can you fix an adult? Absolutely. But that's fire. I call that fire. We have smoke in kids. We can put out the smoke. It just gets more complex. But, coming from someone as an adult, like, I'm in the middle of my airway journey. I had what's called a MARPE placed. It's a custom expander and opens up your jaw as an adult to open up airway space. And then I'll go through some myofunctional therapy to train my tongue, and I'll look at that. I'm doing pelvic floor therapy. I'm doing chiropractic work. So I like to do these things too, so I can speak to my patients about it.
Yes,
And,
yes.
And so it's getting the whole team. But I agree with, yeah.
I certainly, thought of myself as being an educated parent. I never brought my newborn in to a pediatric dentist. I didn't even think you needed to start to see a dentist until they start to get teeth.
Yeah. Well, and listen, when we look at it, right, the AAPD, which is the American Academy of Pediatric Dentistry, by year 1, you want to see a dentist. Like, that's what you want to do.
Uh-huh.
But if you have any concerns, just like you said, I always tell my parents, like, your mommy gut, your parent gut, it is right.
Yes.
Trust it, and I would rather see you and follow you and watch these milestones than not. The American Academy of Pediatrics says that every child should be screened for airway health within their first year of life. But no one's screening their airway health.
No.
So I have become that person, and I love being that person when I can see babies right by a year. And I love when they haven't had issues before. But every single exam, we're looking at how is your palate growing? Because the roof of the mouth is the base of the nose. We're looking at what is your tongue function? What do your tonsils look like? I cannot see adenoids clinically, but I can see tonsils. And when tonsils start to get inflamed, it's telling me a story. Are your kids chronically getting strep? Are they breathing with their mouth open? Are they drooling on the pillow? Is their hair a mess? Are they having, ADHD-like symptoms? So we're asking these questions in our health questionnaire at every single appointment to try to just, screen, number one, and then also bring your awareness. And if a parent is like, I don't know, I'm like, go home. Let's watch for these things. Because a lot of it's not happening until deep into the REM sleep cycle, which can be 2, 3 a.m. And who's up at that time, right? Mm-hmm. And I, as a parent, my older son is 3.5. I was the first person to say he doesn't sleep with his mouth open. I happened to be on the West Coast, turned on the monitor at home, and I was like, oh, okay. Because I got to see him at a time that I normally would have been sleeping at home. And from there, his symptoms started spiraling. So I think, especially my patients, I'm able to talk to them as a provider, but also as a parent who's been through this. And figuring out the journey too on my own with my own kids.
Which
Which has been really interesting.
What are some of the symptoms that manifest in older children that make you worried about the airway? Like
Oh my God.
sucking
Yeah,
thumb,
absolutely.
putting
So
fingers in the mouth to lower the tongue?
so when you think about in older kids, so like when I even from just dentistry, cavities are a symptom. Why do we have these cavities, right? Mouth breathing is the number one cause of cavities. You can brush, you can floss, you can do a really good diet, but if you put air in the mouth, and we know this, we know that dry mouth in adults puts you at a
Oh,
higher
yes,
cavity risk,
definitely.
right?
Absolutely.
It's the same concept in kids. It's dry
Oh,
mouth when you mouth breathe, when you think about it, right? Um, I have older kids who still are having speech concerns, wetting the bed. Wetting the bed has been one of the biggest ones lately. I'm seeing these kids who are like 9, 10, 11, 12, and the parents are, driving 2, 3 hours to me going, they're still wetting the bed, and help me. And I look at them and they have these really high palates, their tongue has low tone, and they're not sleeping well. So there's no regulation because when you're a mouth breather, you're at a sympathetic state. And that sympathetic state, the way I explain it to, a kid, I'm like, right before you have to take a test, right? And you're like, oh, I have to pee. I'm about to take a test. It's the same concept. You're
oh,
at that,
right,
that
right.
state during sleep, and then you have no bladder control.
And I
So,
also
yeah,
wondered if disrupted sleep affects the antidiuretic hormone, which allows you to concentrate your
a
urine.
1000%. Absolutely.
Uh-huh.
Yep.
Uh-huh. It's
Right,
interesting.
and you think about when you get into that REM sleep, which you probably know a ton about this from patients you treat, how much of your systems have to be regulated then? Like your growth hormones being released, all of your digestive tract, like that's when your body recovers.
Yes, you have
So
to have good sleep
you
or
have to have restorative
mhm.
sleep, and these kids are not having restorative sleep. So at the end of the day, like, and this is a motto straight from the Breathe Institute, and I preach it every day. It's tongue up, lip sealed, healthy breathing through your nose. Like that's what we got to do. And if we
I
can
love
get
it.
that to
Say that
happen,
again. Tongue up,
tongue up, lip
lip
sealed,
sealed,
healthy breathing through your nose.
through the nose. Yeah.
And that's like a Breathe Institute, like that's a motto. Like and as an affiliate, like I live by that. Like that's from the infant through the adults that I'm seeing. It's like we got to. That's the end goal is nasal breathing. How do we get
Nasal
there?
breathing. And it just seems like a lot of children that have any kind of sleep problems or breathing problems, they're taken to the ENT and they automatically have their tonsils out. And that's major surgery. It's painful.
Absolutely.
You lose lymphatic tissue. And I'm not a pediatrician. And this podcast is not medical advice. It's for edutainment,
Mhm.
education, awareness, to get people thinking about things. We have a lot of medical people who actually listen to the podcast as well as our lay audience. But it didn't intrinsically seem like the right thing to me.
It's a band-aid, right? And I'm not saying there are kids that need tonsils. I work with
Uh-huh.
phenomenal ENTs that do partials. And I'm very pro partials because you're leaving lymphatic tissue intact. It's not as invasive. When I have a young kid who like they just can't breathe, and I'm looking at these tonsils going, okay, you're 2.5. I can't even get you into an expander. I can't even guide you to my airway orthodontist I work with to do this. What are we gonna do? But having a less invasive procedure or trying other things, decreasing the inflammation around the household, going to a low inflammatory diet, clearing out the nasal system. Like we definitely go through like things to consider before you do tonsil surgery. Doing things, home environment checks, airway checks, diet checks, sleep hygiene checks to kind of do the best we can. But at the end of the day, kids who have had tonsils, adenoids, ear tubes, that is a red flag to me that they don't have a healthy airway space, which typically means we don't have jaw space, which means we're going to have to do something with that function. So,
Interesting.
yeah,
Now, what about prolonged thumb sucking? I'm thinking about
yeah,
my oldest granddaughter, who the only time she sucks her fingers is at night, and I always thought it was to pull her tongue down to open up her airway.
absolutely it is. No, like yes, there's the non-nutritive, just like you're giving that kind of reaction. The roof of the mouth has that little papilla area that gives a lot of sensory input, but most of the time when it becomes prolonged, it's because you now have narrowed that upper jaw, and your thumb is a happy home. So your tongue, again, we talk about tongue up. If the tongue doesn't have a home to go to, it's going to want to go low. So what's the solution to nasal breathe? Great, I'll put my thumb in, I'll put a pacifier in, I'll put fingers in, because that'll house in that space. So it is an airway thing at the end of the day. And those are the patients that you can work through it. You can do what's called oral myology, myofunctional therapy, train the tongue. You can also do expansion and create more room and then train the tongue. So it just depends on how we can get a kid out of that.
Interesting, because her mother was a long-term thumb sucker
Yeah.
and apparently had a very high palate and had to have
Mhm.
palate
Yeah.
expansion. So maybe if you intervene sooner, you might be
In
not have
theory,
to do that.
absolutely. The shorter the time we do those habits, the better we're going to have. But like, there's also like genetics that play into it. And there's a really awesome book by Weston Price, who he's a dentist, and he's going out and looking at skulls, right, from that,
Interesting.
18th, right. And we didn't have these problems. We were well developed. We had room for all 32 teeth. Our tongue had space. We had beautiful airway space. We didn't have chronic diseases. We weren't on medications. And it's a lot of things, right? But it's how our diet was. It was the toxicity in our environment. But you look at the skeletons, and they had these gorgeous broad smiles. And we're
Uh-huh.
seeing kids now, and I will tell
Smaller
you,
faces.
probably 98% of my patients have an expander. Like, we'll get one or have one. It's
Huh.
everyone. But that's because we're shrinking as a human population. How many of us, we don't have wisdom, don't have room for wisdom teeth. So like, my generation, everyone got their wisdom teeth out. Now I'm seeing the next generation that don't even have them, because we're basically evolving so quickly. It's so fascinating. So our jaws are shrinking, so our body's like, we don't need these teeth.
Wow.
I
And
know,
what do you
right?
think it is dietarily that our jaws are shrinking?
We're not chewing. Kids are
Hmm.
going out and eating pouches there. And
Oh,
these
that's
may be
right.
the.
I see these parents like squeeze stuff in the kids'
Mhm.
mouths, and I'm like, I didn't do that. Only one of my three sons has all his wisdom teeth, and he's got that big jaw.
Does he have the beautiful paw? Absolutely. That's what you
Yeah,
see.
he's got a big
Yeah.
smile and a big jaw.
Yeah.
He's been on our
Yeah.
podcast,
Yeah.
Stephanie
That right.
Thacker.
And that's it's
No
so
relation to me.
rare. So it's so rare to see that. It's so
Yeah.
important. I mean, it is. It's the pouches. It's the ease of life. I think it's an interesting, there's been question around why we're seeing more releases than we ever had. And I think that's definitely some controversy, but we're also having a push of a population, a generation that wants to breastfeed. You know, my generation, most of us were bottle fed. It was formula because that's what the push was for. And now you have back a generation that wants to breastfeed, but if you can't do it functionally, it's fascial restriction at the end of the day.
So there's
So
better oral and facial development if you've got to work for it harder and breastfeed as opposed
absolutely
to
right. You
bottle
have to
feed.
chew. You have to put your tongue in the right spot. Your tongue has to be able to develop. You have to be able to. You're right. It's all of it. There weren't. I mean, there were thumbs back in the day. We didn't have pacifiers. We didn't have those things. We chewed, and that chewing power develops all of that. But if you can't chew because you don't have the space and you don't have the function, you're gonna those evolve into those picky eaters who never learned how or couldn't do it.
Hmm.
Yeah, right.
Yeah, so that you don't want to like give your young child like too soft or too easy a food. I know my
No,
granddaughter
I mean,
sometimes say,
listen,
I don't want the meat. It's too hard to chew. I'm
that's one
like,
of the
no, it's good
biggest
for you.
questions I'll ask. Yeah, I mean, that's one of like my screeners are like, tell me what their diet. What are they eating? Are they eating not crunchy? Because they'll eat a goldfish. They'll eat a veggie straw. It's the meat. It's the steak and the chicken. Or they're like, well, they'll eat a chicken nugget, but they won't eat chicken. A chicken
Uh,
nugget's pre-chewed. You don't have to work so hard for that. Um, so that's one of my big red flags of like, oh yeah, they're pocketing, they're spitting out, they refuse to eat it. That's not typical pickiness. And I think also what happens a lot, and you probably hear this too in the medical field, common is not normal. Right?
yes,
We have a lot of things that get written off because it's amongst all the kids, but it doesn't mean it's normal and we shouldn't be
right.
doing
That's
it, right?
true. That's true. And there's just so
Yeah.
much more childhood illness now than there
Oh my
were. So much
goodness.
more allergies, so much more
I,
intolerances.
yeah, we go through every patient every morning, and I've been practicing in pediatrics for this is my 10th year. It is night and day from when I started, even in the past 10 years, of what's happening in these kids' medical histories. But if you think about it again, what's the most nasal breathing? 70% of your nitric oxide is stored in your nasal passage, and your nitric oxide controls most of your systems in your body. So if you're not distributing that, you're going to have way more chronic illness. And the answer's a pill or medicine, right? But we have kids that I've treated and with an amazing group of other providers, and I'm lucky to be a piece of it, where they're off ADHD medication, off their. I had one the other day that's no longer on his asthma medication.
Wow. Wow,
Right.
that's
Well,
great.
asthma is inflammation of the lungs. So if we can get nasal breathing, get more nitric oxide, and decrease your body's inflammation, yeah, it's
And certainly there's that push for anti-inflammatory diets, reducing
absolutely.
inflammation in our environment. And we've had a prior podcast on ADD with an ADD specialist, and I've always been interested in, um, not just going straight to medicines. And some of the medicines have been associated with uh, reductions in growth and height by
Oh
putting
yeah.
kids on these psychostimulants
Hmm.
to get them focused. And I just thought that, a more holistic way is better. We've had podcasts on functional medicine. For those of you suffering with allergies and asthma, if you haven't heard the podcast I did on, how to reduce allergens in your home, go back and listen to that one.
Yeah.
Because
Oh
at
yeah, that's
night,
huge.
people with pets and dust mites and these
I go through a
pillows
whole
and
checklist, and that's one of the biggest things. Like, get
bedding.
pets out of the bedroom, put an air filter in. We need to all get together on a podcast because these sound like good people.
Yeah,
Like,
yeah.
but that's what it is, right? Like, you even. I did my clinical research on the overdiagnosis of ADHD with sleep disorder breathing, and I'm not saying that there's not ADHD out there, but how
Uh-huh.
much of this is worsened by because our sleep quality is so bad,
Yeah, so that whole
right?
link with the sleep and the behavior,
All of
dental and
it.
facial development, restricted airway, like you say,
Yeah,
it affects everything, right? Their growth, their
yeah.
sleep quality, their functioning in school and at home.
Yeah. And we know this. We know this from 1800s. There's books that show that long faces, those adenoid facies. Like, we have this in textbook. We know there's like a visual appearance of these people who aren't sleeping. Um, but we can correct that and we can change that.
Well, that is like
Yeah.
so exciting. But I understand that one of the most concerning statistics I've read is that 95% of airway disorders goes undiagnosed in children. So, what should parents and pediatricians be looking for, and how can they catch it before it's chronic? And since we have listeners all over the world, how can some of our faraway listeners find someone like you?
Yeah. No, these are all fabulous questions, and I believe that statistic to be so true because unless you're seeing someone like we talked about that knows what to look for, they're not going to ask. I think it goes back to parents need to be their advocate and start searching. And if you're questioning any of these things or you're noticing signs and symptoms, like, we have so many resources of just even going, it sounds ridiculous, but go put your questions into chat GPT and they're going to say, yep, this is airway. Like, I have had patients find me that way.
Oh,
They're like,
really?
what?
Oh,
My
that's
kid is
great.
doing this and they're
Uh-huh.
finding me. Pediatricians, I mean, you have to ask the questions. We should be doing sleep questionnaires. We should be, but it's unfortunate because a lot of the public medicine, like, they don't have the time, and that's not an excuse, but it's what happens. They're looking at a
Well, and it's
full
not something that's on
body.
the checklist or that's
No,
incentivized or part of
no.
the medicine. So,
And they don't know what more to do besides send you to ENT or sleep medicine. And at the end of the day, just like we talked about, that's not a solution. That's a band-aid. So I think the best thing as a parent, like, if you're seeing kids with sleep issues, digestive issues, speech issues, behavioral issues, like, go start putting their symptoms into any honestly, ChatGPT, and just being like, is this correlated? The Breathe Institute has a whole hub of providers. Like,
mhm.
there's ambassadors and there's affiliates. I encourage you to find an affiliate. Truthfully, I've been through both programs. I mean, I respect everyone that's taken any of their courses. They're fabulous. If you can only find an ambassador, go for it. But affiliates just have a higher level of training through them.
and
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 look,
how
yeah.
can someone go about doing that?
So you go to the directory. They have a whole
Okay.
directory on the breatheinstitute.com. You can look for a provider in your area.
breatheinstitute.com. We'll have that in the
Yeah.
show
And
notes.
it doesn't have to be a pediatric dentist or a general dentist. It may be a myofunctional therapist who has done training with them that you're able
Oh,
to.
interesting, interesting.
Yeah. I mean, there's other providers. They've had ENTs do trainings with them. They have had occupational therapy. I mean, there's other providers besides dental providers that
Okay.
are great in. I mean, I work with a ton of myofunctional therapists, and they're looking at oral motor function, and if they can help guide you as well. So look for someone that has the expertise and knowledge that they're mentioning these things. Look on a website, look what they're talking about Airway, and ask the questions. And
And
I think,
how is this getting integrated? Like, do you do educational like CMEs or presentations to pediatricians or other healthcare team
it's
members that might overlap?
yeah.
or school?
There's, and I think that's one of the biggest goals out of the Breathe Institute truly is just to get the research out. As a provider who's working, 4 to 5 days a week, it's hard for me to do that. I have been, if I'm invited to something, I will happily go. I've gotten invited into general dental offices to give it. In Ohio, accreditation's funky, so I can't give CEs, but if I'm invited to someone who holds that, I absolutely could.
Uh-huh.
But it's pediatricians are I've had good coffee dates with them, and I have some, especially the integrative, the holistic ones. I have a ton that are phenomenal that are listening. And I think that's the other thing. Like I've had parents go like, I'm finding someone integrative medicine. Um, it's those providers, and I think it's going to take one at a time. But there's a powerhouse in Cleveland that's really trying to push it. Some really good ENTs that are trying to get pediatricians to listen. So, and getting other healthcare providers and getting general dentists to ask these questions and getting, it's all of us, but it's going to take just teaching them one thing at a time.
Well, that is so exciting to
Yeah.
know that we have such an innovator and trailblazer like you here in Northeast Ohio. Tell our listeners how people can follow you on social media, get an appointment.
So yeah, we're in Twinsburg, right at the kind of Solon Twinsburg border. It's called Great Beginnings Pediatric Dentistry. Our Instagram is GBPD Smiles. So Great Beginnings Pediatric Dentistry Smiles.com. There's some good content on there, and we were really
There's
trying to
great
put in for.
content.
I'm really listen. My boys are my guinea pigs. They're all over. They're my little models, but I'm really
They're
trying to
so
get the
cute.
information. Oh, thank you. You're so sweet.
You gotta
Um,
try for a girl though. I'm pushing for that.
Listen, they're phenomenal. It's a great place if you're looking for information. Our website is the same thing, gbpdsmiles.com. So, and I always take new patients. If you have questions, and my email is drrachel@gbpdsmiles.com. Feel free to reach out. I'm always happy. This is my passion. I'm happy to talk about it. I'm happy to help answer questions. I've had parents call me from other areas, and I try to help guide them and find them providers. So I'm happy in any way.
Well, you are so terrific, and we'll have to have you back in another future season because there's so much to talk about. And I just want to thank our listeners for joining us. Remember, give us a 5-star rating and share this. You can share this podcast with anybody in your friends or circle. And remember, tongue up, mouth closed, and breathe through your nose. And be strong, be healthy, and be in charge. And join us next week in the Sunflower House